Alright, so then we can move on to the abdominal portion. Obviously, the patient would be exposed. You just want to inspect for the skin color, any abnormalities, any masses, any muscle separation or anything. You can see any hernias there. You can have the patient tuck their chin to their chest and kind of bear down a little bit, see if you can see any hernias there or anything. So then the next thing we'll want to do is palpate the abdomen. You're just checking skin, looking for any lesions, any abnormalities. You're checking temperature, moisture, anything like that. Then we want to use our stethoscope with the diaphragm and auscultate the 4 quadrants. So we'll start in the right upper. You're going to be listening for bowel sounds or any abnormal sounds. You move your way through the 4 quadrants. And you can use the bellow, your stethoscope, and to the superior and to the right of the umbilicus, you can auscultate, and you can hear right renal artery, and then also on the left side, in the same position, left renal artery, and then just superior to the umbilicus, you can hear the aorta. Then you want to percuss the abdomen. Use 2-finger technique. Percuss through the 4 quadrants. You're listening for tympany and dullness. You'll hear tympany over hollow organs, dullness over solid organs or areas of stool. Percuss over the liver and the spleen as well. Then you want to do some palpation. Palpation. You'll do light palpation first. Kind of work your way through, checking for any masses, any areas of pain, any abnormalities. Then you can do a little deeper palpation. That's use 2 fingers or 2 hands. And then you can also palpate the liver. You have the patient take a deep breath and exhale. And then the spleen, exhale. Very good. All right. This you can also check the inguinal lymph nodes here and check a femoral pulse. And then we can move down to the lower extremity. You can do this while we're sitting or lying, whatever. Inspect and palpate lower extremities, looking for any abnormalities, checking muscle mass, hair distribution. We want to check range of motion. You also check for edema. You can do that by depressing the top of the foot and releasing and seeing if there's any dimpling there. You want to check pulses. So you'll do popliteal pulse behind the knee there, post-tibial behind the ankle, and then on top of the foot, so the dorsus pedis, and that's going to be 2+. You want to check range of motion in the lower leg. So I'll have you flex your leg up, good. Range of motion, good. And then can you move your ankle and your toes, wiggle your toes, very good. You can do that on both sides. You also can inspect the hips. You want to just check for pelvic stability there and range of motion of the hip. I'll have you bring your leg up and then kind of out if you can. That way towards me, good. And you do that bilaterally. Well, I think that should do it for that portion.